High yield points. Chapter 5 RBC Disorders. Bladder type of bleeding is mostly superficial. Skin mucous membrane produces lesions like petechia, ecchymosis, epistaxis, and gingival bleeding. Only bleeding time is increased in these diseases. ITP and TTP, these are platelet disorder, so only bleeding time will be increased and remain everything will be normal like PT and PTT. Factor type of bleeding is mostly deep, joint and muscle, producing lesion like hemarthrosis and hematoma, prothrombin time and partial thromboplastin time will be increases. Bleeding time will remain normal. Prothrombin time. Tests of extrinsic pathway include only factor 7, so don't remember this because very less number of diseases is present in which there is deficiency of factor 7, so PT will be always normal. Partial thromboplastin time. Test of intrinsic pathway. Intrinsic factor is 8, 9, 12, 11. To remember, count from 8 to 12 by skipping 10, so PTT is the real player because there are a lot of disease in which there is deficiency in this factor. Best example is hemophilia A and B, so the one and only one PTT will be increased, remain everything will be normal. WEPT mnemonics. PT test of extrinsic pathway as extrinsic factor is only 7 and used for warfarin monitoring. 7. Factor of common pathway is 1, 5, 2, 10. Can be remembered by 1, 5 and 2, 10 and 2, 5, 10. Extrinsic pathway have only 7 and remaining all factor is intrinsic pathway. Deficiency in common pathway factor increases both PT and PTT like vitamin K deficiency, vitamin K dependent factor 2, 7, 9, 10, hemophilia. Hemophilia disease is due to factor defect like factor 8 and factor 9, so bleeding time will be normal. PT will be normal because these two factors are not the factor of extrinsic pathway, so only PTT will be increased because these are the factor of intrinsic pathway. In von Willebrand disease, factor 7, factor 8 and von Willebrand factor both is decreases, so bleeding time will be prolonged. Von Willebrand factor and PTT will also be prolonged factor 8 deficiency. To summarize, hemophilia A plus B plus clinical feature of deep bleeding, hemarthrosis and hematoma. Only and only look for APTT and that will be rise. Remain everything will be normal. Normal APTT is 26 to 36 seconds. ITP and TTP plus clinical feature of superficial bleeding, epistaxis, petechia, ecchymosis and vaginal bleeding only focus on bleeding time and that will be rise remain everything will be normal. Normal BT is 8 to 10 minutes. Von Willebrand disease only bleeding time and APTT will be increased, remain everything will be normal. DIC everything will be rise except platelet and fibrinogen which will be decreases.